So I'm here with Indrajit Hazarika, who's from the WHO Office of the Western Pacific, Regional Office of the Western Pacific. I was just going to ask Indrajit what he sees as the significance of this new collaborating centre, WHO Collaborating Centre for Workforce Regulation, and what he sees that's going to add to workforce regulation in Australia and the Western Pacific region.
Well, thank you so much for the question. In fact, when we talk about health and healthcare services, and especially with the countries and their commitment towards universal health coverage, one of the key issues that has come to the forefront is the issue related to quality of health services. And when we're talking about providing good quality, safe health care, then what's fundamental is to have a workforce that is regulated, motivated, and competent to be able to provide this care. But as we've seen in countries in the region, one of the biggest limitations or bottlenecks is the weaknesses in the regulatory systems, their ability to be able to ensure that their healthcare providers are fit for purpose, but also fit to practice. And it is with this mandate that the Regional Committee for the Western Pacific actually in 2017 endorsed a regional action agenda item with an emphasis on improving the regulatory systems for health workers. To help us deliver on this mandate and the commitment to our member states, APRA was designated as the WHO Collaborating Centre. Now, across the region, but also at the global level, APRA has been recognized as one of the best practicing organizations on health workforce regulation. And there's a lot that the countries can learn from the current practices, as well as past experiences and the continued learning that APRA has endeavored on a regular basis. So there's a lot that APRA can share in terms of building the capacities of regulators in countries of the region, but also in terms of being a conduit for sharing good practices on regulation and contemporary regulatory approaches. So what we have in collaboration with APRA established is this regional network of health workforce regulators. And through this network, but also through ongoing country support on an as needed basis, we will try and ensure that the regulatory systems are brought to a certain minimum level so that people in these countries can be confident in the kind and the quality of care that they're receiving. Thank you.
Thank you, Indrajit Hazarika. Sorry about that. I also just wanted to ask you quickly, you made some comments and the launch today about the increasing sort of globalization of both the health workforce and for consumers. So is this partly, this initiative partly in response to increased mobility across borders and internationally for both healthcare providers and for consumers?
Oh, that's a great question. Again, as we know that we not only have providers who are transboundary, but also we have our consumers who go to different countries to access care as well. So in terms of universal health coverage, I guess our main mandate is that everyone everywhere should have access to good quality healthcare, whether it's in their countries or whether it is outside their countries. In addition to that, what is fundamental is, irrespective of the country context, irrespective of the resources and the capacities that might be available to it, it is not justifiable in today's day and age to subject people to substandard quality of care. So I guess in a globalized world, what we need to do is we need to take an approach where where all systems, especially the quality of healthcare, is brought to a certain level, which is considered to be acceptable and is also considered to be safe for people's consumption.
Thank you very much, Indrajit Hazarika.